I'm back with Community Health Nursing. I'm Bincy here. I hope you all are fine. So let's continue the discussion. It's a continuity video of the part 1. Here we will be discussing what all the details, what are the other contraceptional methods also. Okay, we had been stopped in hormonal conception. Oral pills we have been discussed, and the other type is depot. Depot we'll be discussing. Depot is a very slow progressing contraceptional method, and it has been divided into 3, that is injectables, subcutaneous and vaginal rings. Okay, so injectable is also divided into 2, that is progesterone only injectables and combined injectables. Okay, in progesterone only there is a standard dose of 150 mg and which is given intramuscularly every 3 months. Okay, and it protects around 99% from pregnancy. For at least 3 months it will be protecting. Okay, so it exerts the contraception efforts primary of ovulation. That means from the ovary, when the ovum is coming out and the ovulation starts. Okay, when the ovulation starts in the uterus, that time, the first when it starts, that time only it compresses. That is the effect of injectables, progesterone injectables. Okay, and the main advantage of progesterone only is like it helps, or does not affect anything while lactation. Okay, lactation means breastfeeding. Okay, and there are many disadvantages of this is like it increases the weight as it's an hormone. Then because of injectable progesterone, there will be a irregular menstrual bleeding. Dysmenorrhea can occur, and also it may occur amenorrhea. Amenorrhea is absence of menstrual cycle. Dysmenorrhea is difficulty in menstrual cycle, and because of this, prolonged infertility can also be occurring, because once in 3 months we are taking it, right? So like if they are planning for pregnancy also, they might be end up in infertility. It's being a complication of it. Okay, then we are discussing about combined. Okay, combined injectables, like both estrogen and progesterone injectables will be given together, monthly intervals. Okay, for 3 days. Okay, either we will be giving before menstrual cycle or before ovulation, 3 days before or 3 days after ovulation. Okay, and main effect is like it gives contraception for 5 years. Fine. So that was all about hormonal conception. Next we are going to read about intrauterine device, and or you can say it as IUD. Okay, intrauterine device is a type of conceptional, okay, which is coming under spacing method. Here what is like intrauterine device? That means something is inserted intra-uterus, inside the uterus. Okay, usually, for example, I can say copper T and lipolupus. Lipolupus is not commonly seen here, but copper T insertion is there. Like a T, like copper metal will be inserted, okay, in the fallopian tube uterus area to prevent the pregnancies. Okay, so that the ovum will not be able to meet the sperm, but all sexual satisfaction, everything will be affected, or like they won't be having such sexual satisfaction and all. But it's a very good way, and a very good way of conception, prevention pregnancy. 99% of people are getting like they are very much satisfied with IUD, usually copper T. But what is the disadvantage of is like dysmenorrhea. Okay, heavy bleeding will be there. Then it doesn't see till now we were discussing like it also affects pregnancy, but it also helps to control or to decrease STD, right? But here what happens, it doesn't control STD. Because of that, if at all a copper T is inserted, but to prevent from STD, condom has to be used. Okay, then pelvic infections will be also there, and the complication of IUD is like lower abdominal pain. See, if it's a device inserted in our body, okay, and once in 2 years we have to remove it. Okay, and then we have to insert it, not the same device, the other device we can insert it. So if it is not removed or not changed, okay, certain signs our body will show. That's a complication, that this the device which has been inserted is affecting our body, or it can cause infection also. So if it is infection causing, the first symptom will be like fever will be there, okay, then low abdominal pain, dysuria, difficulty to pass urine, then pain while intercourse, okay, then irregular menstruation, infertility can also be a complication of IUD. I hope IUD is easy and it's understandable. So next we are going to move on with post-conceptional method. Okay, post-conceptional method is like simple method to control birth. Fine. There are three methods in post-conceptional method, has been divided into three, that is menstrual regulation, menstrual induction, and oral abortification. Okay. Now, menstrual regulation means it's like in uterine device you are aspirating the uterine content within 6 to 14 days after a missed period. That means already sperm and ovum has been met, okay, then you have got a missed period, and within 6 to 14 days what you're going to do is like you're aspirating the content from the uterus. Okay, that is menstrual regulation. This also causes certain complications such as trauma. Once you're aspirating, some of the tissues or some of the cells get necrosis can occur. Okay, trauma can occur, premature labor. So once you have done it, okay, once you have done it as a contraceptional way, so next time when you are trying to have a baby, that time premature labor might occur, or it can increase the chance of ectopic pregnancy. I think so we had been discussed about ectopic pregnancy. I would like to say it once again. It's nothing other than the sperm and the ovum is getting, or it's getting meted on, the baby is growing, the zygote is growing other than uterus. Okay, it's not growing the uterus, it's been the fallopian tube and all. Once it is growing, the fallopian tube get burst, then even the mother's health is going affected by this. Okay, so that was about ectopic pregnancy. Then tendency of abortion. Okay, once we have done is also regularly if we are trying for pregnancy, that time there is a chance of getting aborted. Okay, so that was all about menstrual regulation. Next we are going to discuss about menstrual induction. Menstrual induction, it's like disturbing the normal progesterone prostaglandin, okay, balance in the uterus. Okay, 1 to 5 mg is 1 to 5 mg is be inserted in few minutes. Contraction starts, and because of the contraction bleeding occurs, and bleeding will be there for 7 to 8 days. That nothing, menstrual induction. So means we have been giving or we have been doing an artificial induction of the uterus to contract and the uterine content to come outside. Okay, for that we will be inserting 1 to 5 mg of prostaglandin. Okay, that is prostaglandin, progesterone balance we will be affecting, we will be disturbing it. And what happens is like within few minutes the uterus get contracted. When the uterus get contracted, the content what is there in that, or the sperm and the ovum made a zygote. That zygote or the embryo will be discharged, coming out through the bleeding. Okay, within the bleeding should decrease within 7 to 8 days. Okay, then about oral abortification. Oral abortification means it's through oral. Okay, through while inserting through a drug through orally, we have been aborting the we have been the preventing pregnancy. Okay, that is also same way like sperm and the ovum has been met and has been formed a baby, or it had been found an embryo or a zygote. After that you have been thinking like, oh my god, that person has been become pregnant and they want to legally about it, then they will be having oral abortification. And that is like we have to have oral drug, okay, which is available name as MTP kits, that is medical termination of pregnancy kit. Okay, and it contains of 5 tablets. Okay, that is the first one, the bigger tablet, that is mifepristone. Okay, mifepristone, and other 4 tablets, that is misoprostol. Okay, and this is very effective till within 7 weeks. Okay, within 7 weeks, I think so, 3 to 2.5 months also they can do it. Okay, It also has complication. It can like ectopic pregnancy can be there, infertility can be there, menstrual bleeding, menstrual regulation. Okay, anemia can also be caused because the bleeding will be that because uterus get contracted, right? When the uterus get contracted and all that, pain and all will be very much. So that was all about post-conceptional method. And next we are going to discuss about miscellaneous, that is abortion. Abortion is nothing, termination of pregnancy. Abortion has been divided into two, that is spontaneous and induced. Okay, spontaneous means natural, or we can call it as a nature's method or to control birth. Okay, spontaneous means like every normal pregnancy, in every 100 normal pregnancy, 15 percentage will be like spontaneous abortion can occur. Then induce means deliberately we don't want it. Deliberately you want to abort the baby or the child. Okay, there are two types, that is legal and illegal. Okay, so illegal is very much dangerous, and usually in India it is not preferred. Legally we can do it usually through other methods also. So certain complications for induced abortion is like hemorrhage will be there, infertility, ectopic pregnancy, increased risk of abortion for coming on pregnancies, then decreased birth weight, then shock, sepsis and cervical injuries will be the late complications of induced abortion. So this was all about population. We have population and its control we had been discussing from community health nursing. I hope you all understood. If there is any doubt, please get back to me. Thank you. Have a nice day.